I want to talk about something that comes up in my practice more than you might think. The patient comes in, they've done their research, they're considering a procedure, and somewhere in the conversation, they mention that they've looked into options abroad: Turkey, Mexico, Colombia, Thailand. The price they saw online is a fraction of what they're being quoted here, and they want to know, is that real? Is it safe? Am I missing something? That's a fair question. And I want to give you the honest answer, not the surgeon's marketing answer, not the medical tourism website's answer, the actual honest answer with real data, real numbers, and a clear eyed look at what you're actually weighing. Because here's the thing: the CDC just published a formal report on this 6 weeks ago. June 3rd, 2026, they reviewed 10 years of data in the US residents who traveled for cosmetic procedures, domestically and internationally. And what they found is worth knowing. I'm Chris Lee, MD. This is Honestly. Let's get into it. The timing of this episode is deliberate. The CDC published a study in their Emerging Infectious Disease journals on June 3rd that reviewed more than 2,100 reports of U.S. residents who traveled for cosmetic procedures between 2014 and 2024. They identified 21 investigations involving approximately 145 patients who experienced serious adverse outcomes, including infections and, in 4 cases, patient deaths. 20 of those reports involved post-surgical infections. 12 of them involve suspected or confirmed non-tuberculosis mycobacterium infections, a particularly serious category of bacterial infection that's difficult to treat, requires prolonged antibiotic therapy, and in some cases requires surgical debridement for removal of implants to resolve. These aren't minor complications. These are life-altering events. The CDC also noted that identifying and responding to these outbreaks is made significantly harder by the fact that patients travel home across multiple states after their procedures. There's no single reporting system, no easy way to connect cases, and no continuity of care when the surgeon who operated is on another continent. When something goes wrong, it often goes wrong at home, managed by a doctor who didn't perform the procedure and who may never have seen the operative report or the facility where the surgery took place. At the same time, I want to be honest about this. The Hollywood Reporter just put out an A-list aesthetic issue yesterday, July 15th, includes a full medical tourism guide. Over 3 million people a year travel for cosmetic surgery. The demand is real, the motivations are real, and there are skilled surgeons practicing in accredited facilities in other countries. I'm not here to pretend that doesn't exist. I know friends who have gone abroad and had great results. What I want to do today is give you an honest picture of both sides of this: the data, the math, the risks, and a real framework for making a decision, not a reflexive don't do it. Why people consider it, the legitimate reasons. Let's start. Let me start with what's actually driving this, because if I dismiss the motivations without understanding them, I'm not being honest with you. Primary driver is obviously cost. Cosmetic surgery in countries like Turkey, Mexico, Colombia, and Thailand is often advertised as 40 to 80% cheaper than it is in the United States. For the same procedures, the numbers are dramatic. A rhinoplasty that might cost $8,000 to $12,000 here is quoted $1,500 in Vietnam. Tummy tuck at $12,000 or $18,000 in the US is quoted $3,000 to $5,000 in Turkey or Mexico. Those numbers are real. For patients who don't have financial resources to access board-certified plastic surgery in the US, the gap is not a trivial consideration. I'm not going to stand here and pretend $10,000 doesn't matter. And to be honest, there are plenty of places in the US that are cheap that you also can get terrible results. There are also other drivers. Some patients specifically seek surgeons who share their cultural background or language. Some are looking for procedures that aren't widely available or aren't FDA approved in the United States. Some are combining the trip with visiting friends and family abroad. These are real human reasons that deserve to be taken seriously and not dismissed. So I want to be direct. This episode is not never get surgery abroad. It's here's what you need to actually understand before you make that decision. Because there are things the medical tourism marketing doesn't tell you, and you deserve to know them. Let me walk through the cost math, because this is where I think the most meaningful gap exists between what patients expect and what the experience actually costs. On paper, savings are dramatic, but the advertised price is almost never the complete price. So let's build that real number here. Flights, depending on your destination, can add up to 800 to 2,500 round trip. Accommodation for the required pre and post operative period, typically 7 to 10 days minimum before you can safely fly home. Add another 700 to 1,500. Most all inclusive packages do include accommodation, but not always at the recovery standard you'd want. And extensions cost more. Medical tourism facilitators, when used, charge fees. Translation services, if needed. The time off of work for an extended trip versus procedures closer to home with a more predictable recovery window. Now add the follow-up care. The surgeon who performed your procedure is in another country, so it's not like you're going to be going back and forth to see them. Post-operative visits, removal, drain management, complication monitoring, these all fall to your local doctor at home who didn't operate on you and may not have access to any of your operative records. If you have a question at 2 a.m., 3 days after surgery, you're calling someone you've never met, navigating a time zone difference, and they may not help you. And then there's the complication scenario. One study found that more than half of the patients who traveled abroad for discount surgery or cosmetic surgery required some form of treatment at home afterward. Wound care, removal of surgical objects, hernia repair, implant removal, visions. The average cost to manage those complications is, $15,000 to $150,000, almost entirely out of pocket. Because most insurance companies don't cover complications from elective procedures performed abroad, depending on the complication. Obviously, if you're very sick, a hospital will have to take care of you. But if it's a cosmetic issue, you're on your own. A procedure that looked like a $4,000 surgery can become a medical nightmare when something goes wrong and you're paying for it entirely yourself at home. I want to be careful how I frame this because I'm not saying complications are inevitable or even likely at a reputable facility. I'm saying the financial risk structure is fundamentally different than what the advertisement showed you. And differences matter when you're making the decision. So, take that into consideration and figure out what makes sense for you. Now, let's talk about the specific risks the CDC highlighted because they're worth understanding in detail. The most common reported complication category was infection, specifically post-surgical infections, many of them non-tuberculosis mycobacteria, or NTM. This is a category of bacteria that lives in water or in soil, is resistant to the standard antibiotics, and can cause severe persistent infections in surgical wounds. The reason it shows up disproportionately in medical tourism cases is specific. NTM infections are strongly associated with lapses in surgical equipment sterilization and environmental cleaning practices. The CDC's own infection prevention and control assessments during 2 of these investigations, one domestic and one international, identified what they called significant deficiencies in environmental cleaning, PPE use, hand hygiene, and surgical equipment reprocessing at the facility involved, which is a lot of the reason why they tend to be cheaper, because they don't have as much overhead cost to make sure that they're staying clean. This isn't a reflection on the skill of the surgeons. It's a reflection on the system surrounding the surgery. In the United States, accredited surgical facilities are subject to rigorous, regular inspection by independent accreditation bodies. Things like the Quad A certification for outpatient surgery centers, JACO for hospitals, and anyone who takes insurance. The standard of sterilization, environmental cleaning, and infection control are enforced by external oversight. That doesn't mean U.S. facilities are perfect. They're not. But the regulatory infrastructure that catches and corrects these lapses is substantially more developed here than in many popular medical tourism destinations. The other risk that the CDC and the ASPS consistently flag is travel itself. Long flights in the immediate postoperative period significantly increase the risk of deep venous thrombosis and pulmonary embolism. These are blood clots that travel from the legs and can travel to the lungs through the heart. After a tummy tuck, a Brazilian butt lift, or liposuction of large areas, the risk of DVT is already elevated. Flying 8 to 12 hours home 3 to 5 days after surgery compounds that risk substantially. ASPS recommends waiting 5 to 7 days before flying after any body procedure and 7 to 10 days after facial procedures. Most medical tourism packages build in the stay at length, but patients who leave early or who have extended recovery needs face real consequences from that flight home. None of this is even discussing the unreported problem, like cosmetic issues with the surgery or after surgery. What happens if you're botched? This happens all the time, and I have many patients who've come through my door in tears because their butt is square after BBL in Turkey, or their abdomen is bumpy after liposuction in the Dominican, or their tummy tuck that they got awake at Sonobello because it was cheaper looks awful. This happens all of the time, and it takes a lot more effort, time, and money to fix a problem than to do it right in the first place. Revision surgeries are inevitable at some point. No one shoots 100% all the time, and they are inherently more demanding. If I've operated on you and it's not up to my standards and you're not happy, I'm always going to find a way to make sure we get it right and done at the best of my ability. And if that means comped revisions, then that's what I do. It's a lot harder to get that with an abroad surgeon. And to fix major issues or completely revise the original surgery is always much more difficult due to scar tissue and possible need for multiple revisions. So the cost is usually significantly higher than the original surgery, even if that original surgery was done in the US. I don't want to paint every situation abroad with the same brush because that wouldn't be honest. There are meaningful differences in risks based on several factors, and I want to give you the framework for thinking about them. The procedure itself matters a great deal. Some procedures carry higher inherent risk of serious complication regardless of where they're performed. Things like the Brazilian butt lift is the obvious example, with a mortality rate that has historically been the highest of any cosmetic procedure, especially when done incorrectly and too quickly in large volume areas. Combining multiple procedures in a single setting increases operative time and risk. Liposuction of very large volumes is higher risk. Choosing to pursue high-risk procedures in a less regulated environment is a different calculation than choosing a straightforward rhinoplasty at a well-credentialed facility, or a straightforward hair transplant at a place that does only hair transplants. The facility's accreditations also matter. JCI accreditation, or Joint Commission International, is the international equivalent of the U.S. accreditation standards and is a meaningful differentiator for clinics. Not every clinic abroad that markets to international patients holds JCI accreditation. Asking specifically whether the facility is JCI accredited and verifying it independently rather than taking the clinic's word for it is a good starting point. The surgeon's credentials also matter, as they do here. The international equivalent of board certification varies by country. ISAPS membership, International Society of Aesthetic Plastic Surgery, is a reasonable proxy for surgeons who have met international recognized training standards. A surgeon's social media presence is not a credential. Continuity of care matters enormously. How many post-operative days are built into the package? Who manages your care if you have a complication during that window? And what's the plan if you need to stay longer than expected? What records will you be receiving to bring home for your local physician? These are questions that have straightforward answers at a reputable facility and should have straightforward answers wherever you're considering going. And your own health history matters. Patients with complex medical histories, significant comorbidities, or prior surgical complications are at a higher risk, regardless of where they operate. And the ability of a foreign facility to manage those complexities in the emergency is a real consideration. Listen, if you're seriously considering surgery abroad, here's what I'd actually tell a friend to do. And it's not a blanket don't, but a realistic checklist of due diligence that most patients aren't doing. First, get a consultation at home first, not to be talked out of it, but to get an informed baseline on what the procedure involves, what your candidacy looks like, and what the realistic U.S. price actually is. You may find that the cost gap is smaller than the advertisement suggested, or that your particular anatomy makes you a higher risk candidate and changes that calculus. Second, verify the facility's accreditation independently. Go to the JCI website yourself and search for that facility, not the clinic's website, the actual JCI registry. Third, verify the surgeon's credentials, ISAPS memberships, national board certification, and look for information on their training, not just their social media results. Results photos are curated. Credentials are verifiable. Fourth, read the package details carefully. What exactly is included? What is the plan if you have a complication during the recovery period? What records do you receive at discharge? Is there a relationship with the local hospital if emergency care is needed? Fifth, plan the full cost honestly. Build in flights, accommodations, potential extensions if recovery takes longer than expected, follow-up care at home, and an honest assessment of your financial exposure if something goes wrong. The number end of that exercise is your real cost comparison, not the headline price. And sixth, if you've already had surgery abroad and you're home recovering, if something feels off, if your wound doesn't look right, if you have a fever, if you have leg pain or shortness of breath, don't wait. Go to the emergency room. Tell them where you had surgery and when. The sooner a complication is identified, the better the outcome. Any complication of that magnitude or that severity will be taken care of and should be taken care of by the emergency room to make sure you're stable and will be covered by your insurance, unlike cosmetic complications, which are going to be out of pocket. So here's what I want to leave you with. Medical tourism for cosmetic surgery is not inherently wrong. There are skilled surgeons in accredited facilities in other countries, and the costs of savings for some patients are genuinely significant. I'm not going to dismiss that, but the CDC data is real and incomplete. The complication math is real, and the information asymmetry between what medical tourism marketing tells you and what your complete picture of risk actually looks like is also real. The patient who end up in the worst situations are almost always the ones who made the decision based on the headline price and the before and after photos on someone's Instagram without asking the harder questions. If you're going to consider it honestly. Do the full due diligence, know what you're actually weighing, and if you want a baseline consultation with someone who will give you a straight answer about what you need and what it actually costs here, that's exactly what a good consultation is for. If you found this helpful, share it. It's the kind of information that's genuinely hard to find in a format that isn't trying to sell you something. Follow Honestly on YouTube, Apple Podcasts, or Spotify. Leave a comment with your questions. And if you want to talk about your specific situations, reach out to us here at Clarioplastic Surgery. The link is in the show notes. I'm Chris Lee, MD. This is Honestly. See you out there.